OK 今これは取れている。はい、OK です。
Here, I am now with Professor Jaroszewski, the greatest nurse procedure performer in the United States, and probably the most influential person regarding the treatment of pectus excavatum. And as I explained to you, we Japanese surgeons are now in difficulty because we want to use cryo-ablation, but the government does not allow us to use it. Therefore, I would like to explain about the usefulness of cryo-ablation.
So in our own country, cryo has become the standard of care. For all the patients, it has made such a difference in the amount of time they're in the hospital, in the amount of opioid narcotics that the patients have to take, in the return to the emergency room, and getting back to normal life, normal work. It has changed our whole society and how pectus surgery is done in the United States. And from a cost standpoint, it's very expensive, but the cost is upfront, and in the long run, it's less than what you see when a patient stays in the hospital for a week versus 1 or 2 days. When the patients are up walking, coughing, not getting pneumonia, they are getting back to normal life, getting back to work much more quickly. They're not coming back to the emergency room with the complications. They're not having ileus, they're not having vomiting because they're not taking as much drugs. In the United States, there is a very bad opioid crisis, lots of addiction, lots of drugs. And so anything that we can do to decrease the amount of narcotic drugs we use, most patients get very little. We can get by with the non-steroidals like ibuprofen or acetaminophen, and not have to use narcotic drugs.
In conclusion, you definitely think cryo-ablation is necessary for pectus surgery.
Absolutely. It is what's best for the patient. It's what's best for recovery. It's what's best for our society. If you look at statistics, 1 out of 7 patients that have chest surgery will become addicted to narcotics, opioids.
Yeah.
And so anything we can do to avoid that, I think, is critical.
Yeah. And how about the situations of other countries? For instance, in Europe, I talked with the US, UK surgeons, and they said they also use cryo-ablation.
They also use cryo.
And therefore, Japan is very exceptional, I think.
Yes. No, I mean, I think that Japan is behind, right? Because the rest of the Western world knows that this is superior, and they're using that. And so you definitely need to do what's best for your patients and add this.
Yeah. Thank you very much. You are a lifesaver of Japanese surgeons.
I hope so. Let me know. I hope it goes well.
Yeah.
Thank you.
Yeah.